Assalamualaikum warahmatullahi wabarakatuh.
Good day, ma'am and friends. Today, our group would like to present our journal. Before we start, we would like to introduce ourselves. My name is Witasani Iswara with student identification number 2024-025.
And my name is Asyary Idhotul Fadillah with student identification number 2024-032.
So, our topic is stroke with the title A Study on Clinical Profile of Acute Stroke. This original research article are written by a group of researchers from India, which are Avinash Itagi, Bharatji, Pooja Biradar Patil, and lastly, Laxmi Patanashetty. This article is published on International Journal of Advances in Medicine on December 2020, volume 7, and issue 12.
So, what is stroke? Stroke, also known as cerebrovascular accident or CVA. According to the World Health Organization, a stroke is when the blood flow to the brain is suddenly blocked, causing problem with brain function. The symptom lasts at least 24 hours or leads to death, affecting parts or all of the brain. Stroke is one of the leading causes of morbidity and mortality. It is the second leading cause of death globally. The mortality rate of stroke in the acute phase is 20%.
There are two types of stroke. The first one is ischemic stroke. An ischemic stroke happens when a blood vessel in the brain gets blocked, usually by a blood clot. This can happen in two ways: thrombosis, where the clot forms directly in the brain, or embolism, where the clot forms somewhere in the body, travels to the brain, and gets stuck. This type of stroke is the most common, accounting for about 85% to 87% of all strokes. And the second type is hemorrhagic stroke. This type makes up for the rest of the cases. A hemorrhagic stroke happens when there is bleeding in or around the brain. This can be intracerebral hemorrhage, where the bleeding occurs inside the brain, or subarachnoid hemorrhage, where the bleeding happens around the brain. This video explains the two types of strokes. This is hemorrhagic stroke, where a ruptured blood vessel causes bleeding, damaging nearby brain cells. And this is ischemic stroke, where a clot blocks blood vessels, stopping oxygen and blood flow to the brain.
A recent study in Gujarat found modifiable risk factor for stroke in different age groups. Among elderly people, such as hypertension contributing to 40% of cases, alcoholism accounting for 35%, smoking contributing to 28%, and hyperlipidemia or high cholesterol levels seen in 17% of the cases. For young people, the commonest causes are first, smoking, second, alcoholism, third, increased BMI, for diabetes, and last, hypertension.
This is facts about stroke. So stroke incidence vary significantly by region, racial, and ethnic group. In some geographical area or certain groups, stroke rates may be unusually high. In India, about 203 people out of every 100,000 aged 20 and older have strokes. That's around 1 million stroke cases with 7 men affected for every 1 woman. A recent study found that 7% of all medical admission and 45% of neurological admission were due to stroke. A report predicts that by 2030, there will be 23 million new stroke cases worldwide each year. Stroke-related deaths are also expected to rise to 7.8 million annually by that time.
So, the authors wrote this article to assess the clinical features and test results of different types of strokes in patients admitted to a tertiary care hospital.
Now, I will explain the method. So, it was a hospital-based cross-sectional study in the Department of General Medicine at a tertiary care hospital in North Karnataka, India, from November 2015 to October 2016. The population are 100 adult patients who presented within 24 hours of stroke onset, willing to provide informed consent, and eligible to the requirement of the they were being screened. The data collected are demographic information such as age, sex, and comorbid condition. And there's also physical examination such as vital signs and systemic examination.
The next one is technical method. For diagnosis, the nature of the stroke was confirmed using CT or MRI scan. For laboratory investigation, blood samples were collected to investigate hemoglobin levels, platelet count, white blood cell count, and random blood sugar. For data analysis, the data was entered into Microsoft Excel, and statistical analysis was done using SPSS version 20.
Now we move to the results. The first one is about age distribution. So 27% of the patients were between 61 until 70 years old, which was the largest group. The average age of the patient was 58.5 years and the 71% were male.
Clinical and biochemical. From the table, we can see that 41% of patients have anemia, meaning the red blood cell levels are low. 25% of patients have high white blood cell counts, which could indicate inflammation or infection. Over 50% of patients have high blood sugar levels or hyperglycemia. 14% of patients have raised blood urea nitrogen, suggesting some may have kidney dysfunction.
Next one is comorbid condition. The most common comorbid condition was hypertension, found in 38% of patients, with 23% had both hypertension and diabetes. Other conditions included dilated cardiomyopathy or a weak heart, ischemic heart disease, and combination. This combination increased the risk of complications like stroke and heart attacks.
Okay, the last is systemic examination. This table shows the result of the patient's systemic exams. In the cardiovascular exam, 96% of two issues, but 4% had a fast heart rate or tachycardia. It highlights that most patients were normal, but a few had heart or breathing problems that needed attention.
The next is discussion. So stroke is a major cause of death, especially in men aged 61 until 70. Key risk factors included high blood pressure, diabetes, smoking, and heavy alcohol use. Managing these risks with lifestyle change and medication can lower the chances of stroke. To address the growing problem, India has started a national program to focus on prevention and improve care.
Conclusion: ischemic stroke is the most common type in India, showing the need for better prevention and treatment. Managing risk factor needs a team effort, focusing on social issues, healthcare funding, medical training, and improving the healthcare system.
So that's it. Thank
Thank
you,
you everyone for your attention.
If we have any mistake, please forgive us. We appreciate any kind of constructive critique and suggestion. Thank you.
Thank you. Wassalamualaikum warahmatullahi wabarakatuh.